You know, when we think about frontline workers in the fight against COVID-19, we most often think about doctors and nurses, but there are others roaming the halls of local hospitals hoping to provide healing as well. In the face of a pandemic, doctors and nurses bear witness to pain and suffering. But as Dave Lucchese can tell you, that suffering is not only physical.
And in serious conditions like this, it puts people in a confrontation between faith and suffering. And those two are hard to reconcile sometimes.
Dave Lucchese has been a chaplain for 35 years. His job is spiritual healing, and it's never been more challenging.
So they want to know that someone's by their side on this journey with them. You know, and if we can connect a good, strong family member to them also, they've been also, but knowing you're not alone.
Because loneliness only compounds the suffering.
It's a big issue. Because no one wants to be alone and sick in a hospital, but unfortunately, restrictions are there to protect them. And you can't see your loved ones, and you can't see ministers, and you can't see anyone. And it is difficult.
You're behind a face shield and goggles and multiple masks in your gown.
Heath Ferguson has been a chaplain for the past 10 years, but in the past 10 weeks, he and others at Mississippi Baptist Medical Center have experienced more sickness, more death, more fear than ever before.
Sometimes I have to just pause and ask myself, are you really okay? And sometimes, because we see so much, I wonder, how could I be okay right now?
And many on the front lines are not okay after willingly putting themselves in harm's way.
So I found myself praying for friends and coworkers that I'd worked beside for years because they're now in a new danger. And when I go into a room, there's a danger present. And I think about my wife and my two boys and what I don't want to take home to them.
Thankfully, he hasn't. But Dave Lucchese was not as fortunate. Both he and his wife were infected.
We're very fortunate to not to be a very severe case, but even a light case is not good. But I do understand what patients are dealing with and understand the uncertainty of whether they're going to get better or not get better. And it broadened my whole perspective about being a minister in that situation.
Scripture talks about walking in the valley of the shadow of death. Are you seeing that?
Yes, it can be overwhelming. I work with some of the most selfless and tireless caregivers that you could imagine caring for someone. But I worry about them sometimes because that darkness, that being in the valley of the shadow of death and dealing with it and not knowing if there's an end in sight anytime soon.
We can only hope. Two men both praying for an end, but steadfast in faith to help others see it through. Kind of tough out there on the front lines.